Welcome everyone to our webinar this afternoon, Fostering Resilience in Frontline Staff, which is part of our series on resilience, sponsored by the Henry Luce Foundation. My name is Michael Skaggs. I'm Director of Programs for the Chaplaincy Innovation Lab, and I'm very happy that you're with us today. Before I introduce our guests, let me offer a couple of standard reminders. Our veterans know all of this, but I'll tell everyone the same anyway. Like most of our events, this is being recorded, and so if you need to leave early, or if you miss a point, don't worry, you can always watch it later. We'll send you a link automatically within the next probably week or so. When you get that link, there's a second link in the email to a feedback survey. If you could just spend maybe 2 or 3 minutes filling that out, that gives us a better idea of what is helpful and useful to you. So fill that out, please. So now let me introduce our guests, all of whom are from Pine Rest Christian Mental Health Services in Grand Rapids, Michigan. They're all from the same team. It's rare that we have one institution represented across multiple people here, so this is different and really good. Reverend Dr. Randy Myers is staff chaplain and principal investigator for his team's project. Dr. Gretchen Johnson is chief nurse executive. Amy Mancuso is Pine Rest grants manager, and Bob Vandepoel is Executive Director of Employee Assistance and Church Assistance Programs. Welcome to all of you. Randy, I turn it to you.
All right, thank you, Michael. Appreciate you inviting us to do this, and I look forward to our discussion at the end. I'm gonna figure out how to share the screen here.
Yes, I'm just working on making you host here. Do you have the share option now?
I do, I see it, and sharing sound and video. We see our PowerPoint presentation here coming up shortly. Can you see that?
Yep, you're good to go.
All right, thank you. Hello, everybody. And as Michael has said, our grant was called Fostering Spiritual Resiliency in Frontline Staff. And the presenters, we've already been introduced. So we want to thank the Chaplain Innovation Lab, thank the Henry Luce Foundation. Michael, thank you for your work and resources. And also we want to thank Reverend Dr. Carl Van Harn. He's Pine Rest Director of Pastoral Services, CPE, and Reverend Dr. Lisa B. Taylor, who is our Pastoral Services Manager and scheduling all the coverage so that the chaplains can make this grant happen. So thank you to those folks as well. I want to start with a little history of Pine Rest so that people get a picture of our organization. In 1910, a group of pastors and laity decided to create an organization that treated all aspects of a person's well-being. And this comes from a particularly painful incident where a member of a church brought their child to the state mental hospital, and the spiritual needs were overlooked and underrepresented or undermined, and they said, we can do better. So the members of the Reformed Church in America and the Christian Reformed Church in America came together to create what is today Pine Rest. It's a faith-based organization, but we serve a multitude of individuals from many cultures and religions. Pine Rest does not have a statement of faith for patients or residents or employees, and we offer quality services to people regardless of their race, color, creed, or nation of origin. And so that is kind of where we started, but I'm going to show us where we are today, and this video will help us see that a little more clearly. So here's a little introduction video to Pine Rest. All right, so hopefully that gives us a picture of Pine Rest. Make sure that I...
Brush your teeth in less than 10 seconds with this revolutionary.
All right. Michael, how do I go to the next slide?
You should be able to click just sort of anywhere within the green so that you're getting out of YouTube, and then click right, I would imagine.
Is not advancing.
Or you could always stop sharing and reshare. Might be the best way to do it.
All right.
That was good, Ray. An in vivo demonstration of resilience.
Right, how's this?
That's perfect.
All right. So to recap some of the highlights and to emphasize, Pine Rest is made up of an inpatient and partial hospitalization program. We have 198 beds and an additional 24 beds for COVID positive patients. We converted one of our units, and then we've created a special care unit. We also have a psychiatric urgent care. So much like if you sprained an ankle after hours and didn't want to go to the ER, you'd go to an urgent care center. We have a psychiatric urgent care. We also offer residential services, adults with mental illness, adults with developmental disabilities. And then we have 10 beds for adults who have been COVID positive so they can transition back into their adult foster care facility. We also offer services to medical health systems in partnership with them. We have an outpatient recovery services. We have 20 outpatient clinics across Michigan, community outreach services, and then a variety of telehealth options throughout the country, as well as addiction treatment and recovery services. And we're a part of the National Network of Depression Centers. So this is Pine Rest in a nutshell, kind of our history and where we are today. We also have a thriving education program. We have a residency program for psychiatry with some rural psychiatry, as well as a physician's assistance program. We have psychiatric fellowships. So we have the child and adolescent psychiatry, addiction psychiatry, geriatric, and forensic psychiatry fellowships. As well as we have a clinical pastoral education residency within our CPE center here. In our research department, of which pastoral services is an active part of research, and we've been a part of 3, and I'm not sure we have several in the works, but 3, 1 currently, 2 prior research projects. So that's our education department. And then to focus in a little bit on pastoral services. So prior to the COVID pandemic, while we try to support the organization as a whole, our focus is primarily within the inpatient and residential services. Chaplains facilitate a number of wellness and spiritual growth groups, as well as offering individual visits, and we minister to staff. However, COVID-19 dramatically modified staff's work in order for them to maintain the safety measures, but also manage their own personal stressors outside of work and at work. So we saw an opportunity for chaplain integration. And this came in terms of increased presence with our staff, but also increased presence in different divisions. So the community care management, we have a street reach program where folks are going out into the community, predominantly working with homeless people. And we saw an opportunity to support them through this grant, as well as integrate within our own employee assistance program and the outpatient clinics. The Pine Rest grant through the Chaplaincy Innovation Lab was 3 main focal areas: a supportive presence, spiritual reflection, and education. We created some spaces in partnership with our activity therapy department for 2 labyrinths on campus, a variety of educational materials, and it's a reflective space, or both of them are reflective spaces. we've been able to be at more leadership and staff meetings, as well as integrate within the community care management program, which is based in downtown Grand Rapids. We've also been able to join the outpatient clinics via virtual support, and that was an adjustment to our grant. We were hoping to get there in person, but most of their meetings are happening virtually, so we're able to join that virtual space. For spiritual reflection and education, the chaplains developed a resiliency self-assessment survey, and we were able to survey our organization, and we have around 1,800 folks in the organization, and I believe we came away with about 1,100 surveys back. And that showed us really the level of resilience kind of coming into this grant. And we saw some areas where, as an organization, we were a little bit lower on our resilience. So we're able to tailor our interventions towards some of those lower areas. But chaplains have developed resiliency modules, and we're presenting those at staff meetings and team meetings, as well as presenting them virtually via videos, which then get posted within our organization. And we just started kind of in the second half of the grant, we started chaplain resiliency reflections, which we are sending to the organization, which helps employees to reflect on their own resiliency. So this is the core of our grant. And Michael asked us to share, he asked us to focus in on how we integrated this so well. So I'm going to talk a little bit about how Rest Prevails through spiritual integration. And really we're a fully spiritually integrated throughout the organization and within disciplines. So this comes both from a historic perspective, like I showed in the beginning, and you could see even in the layout of the campus, there's kind of a central sort of chapel-like space on the campus. So even from a physical layout, as well as our CEO, COO, our various leaders, spiritual care and pastoral care is high value. And so the director of our department, when he saw the grant, he called up Amy, our grants manager, and said, "Hey, is this something we could be a part of?" And she's like, "Yes, let's figure this out." Then I know Carl had a conversation with our chief nursing executive, so Gretchen's going to present in a minute, as well as our director of the employee assistance program. And he also spoke with the vice president of outpatient and recovery services. All of this was to kind of get a sense of what the organization needs and how chaplains can support the staff throughout this pandemic. Leads me to Bob. You're going to introduce and talk about our resiliency from an employee assistance perspective, and just give me the high sign when you want me to advance the slide.
Will do. Thanks, Randy, and thanks for everybody who's participating. We're excited about this. I worked at Rest as a clinician for a number of years, left and was part of an organization that grew to become the world's largest in critical incident response, responding to workplace tragedies about 1,200 times every month. Then I sold my piece of that, came back to Rest, and our CEO said, we have tragedies here every day. In our residential programs, we have staff that get assaulted by kids who've had horrible lives and have every right to be angry. Can we help those staff? Within our hospitals, that happens too, when we have suicide attempts, completed suicides, we have assaults, we have people that hear awful things. Can we help? So we established a program through the employee assistance program to take care of our own staff as well. Our EAP has just under 400 outside clients, but of course our favorite is Rest. And so we wanted to do everything that we could, with the joke being, this is what a staff member looks like on their first day and on their 100th day. Next slide, please. And so we established a program that we called Resilience. And it involves several different tiers. One is training. Okay, so we do training for the managers. The managers, how do you help people on a really, really tough day? How do you respond with competence and compassion so that they feel like you know your stuff and you give a rip about them? And then we also did training enterprise-wide, and it's part of every single new employee orientation, which takes place every 2 weeks. There's a 1-hour training on resilience. We also needed to train the managers not only how to respond, but then also how to use the program. We consult with managers all the time about, okay, you just went through this where something awful happened, and sometimes it's away from work, sometimes it's a tragedy. The staff member's child dies in a car accident or something like that. And all right, now how do we work with this team to welcome that person back and to foster their return to work, productivity, and life? We have a model that we call telecare that I'm going to talk about a little bit more. Sometimes we meet with them on site. A lot of what we do is also proactive outbound phone call to impacted people. We needed first and foremost through the training to establish a culture that says, if you need help, it doesn't mean you're a pathetic wimp. But the organization cares about you. And so when you go through situations that would be disturbing to most people, just count on it. We're going to be reaching out to you just to make sure you're okay, give you a chance to process if you want, talk about how it's impacted you, normalize that, talk about what other people have done that's been helpful to them, and help them to establish their own resilience plan. Vast majority of our employees take those calls and engage. Sometimes they blow me off or our team off. Sometimes they say, wow, this is great. Thanks. I really appreciate you do it, but I'm at them all. But we do that. When there are larger scale events, oftentimes we'll pull people together into groups and offer a chance for the same process to happen, adding in additional group support so that we can also say, what do you need from each other? We engaged with Chaplaincy, thanks to the generosity of this grant and this idea, on that one, chaplains are often, almost always, part of any group debriefings, sometimes as a support, frankly, sometimes because they're within the circle of impact and they experienced it also. And we're also, as we make those outbound calls, have been very intentional about, okay, this is here for you. You also know that we have chaplaincy available to you face-to-face or telephonically as well. And people have responded very well to that. Within our EAP, we also developed completely new flyers for Pine Rest staff that lists all of the things that are available, as well as chaplaincy. And so they can use counseling, they can use our other consultative programs and chaplaincy. So we're just marching to the same drumbeat. Next slide, please. Just a real quick look at how it works, why it works. I know this one by heart. I could do it if it doesn't go there. I want to talk about the clinical underpinnings. One is psychological body armor, and this borrowed this from a lot of work that I've done with military, law enforcement, and fire safety. It's helpful for people to know what the impacts are of traumatic stress or high ongoing stress. And so it's important for them to know, okay, I'm going to be shocked, but now I won't be shocked by my shock. So I understand that it's scientific, predictable, normal reactions. The leaders need to know that you tend to find what you look for. And the vast majority of trajectories following a disturbing event are towards resilience. And that if you communicate in a way that victimizes people further, that's what you're going to get. And so we need to change our language to foster that resilience. People also draw a lot of ego strength and a lot of resilience strength from how they feel the organization and how their leadership responds to them. People that feel part of an organization that's tough enough to handle it are more likely to borrow from it. And I can be strong because we can be strong. The Pine Rest Prevails name came from experience with the Virginia Tech shooting, where the overarching theme was, we are the Hokies, we will prevail. We are Virginia Tech. We want that culture at Pine Rest also. Personal attribution means if I blame myself, I'm less likely to bounce back. Normalizing reactions so you don't panic over the fact that you couldn't sleep, shake when you come back to work. It's important to identify what are the problems, what are the dumb things that we often do when we're really stressed, and to know my Achilles heel and to stop myself before I say or do something stupid. Non-invasive psychoeducation. based on what's worked for you in the past. What helps you to resolve issues when you've been stressed? Next slide, please. Logistically, we operate, PIE is borrowed from the military too. It says that when you're going to respond to somebody with psychological first aid, proximity, immediacy, expectancy. Get there as quick as you can and help to set in place an expectation of recovery. There's a phase-sensitive science to it a little bit. We always make it voluntary. It's never mandatory. It's strongly encouraged, but it's voluntary. It's proactive, where we reach out, because we found that if you just say, oh, this was awful, you should call the EAP, the percentages drop. When we reach out to them, percentages rise. Telephonic, face-to-face, confidential, and free. So that's the program that was existent, and how we have integrated chaplaincy. It's made our program so much stronger, and I'm really grateful for it. I think that's the end of my spiffy slides.
Yes, thank you, Bob. Appreciate your expertise and partnership. Now we'll go to Gretchen Johnson. And
so I'm going to talk a little bit about why this was such good timing for our team. So like most people working in healthcare, the pandemic has been very challenging. And as Randy mentioned in the beginning, we did open psychiatric COVID unit. And what we were experiencing is, as I talked to other chief nurses in our state, is that healthcare workers are leaving the field. They're finding that if they're close to retirement, this kind of work they don't feel like it's worth putting themselves at risk. It's been very challenging to work in healthcare. We're doing things that we never thought we would do. I think in the beginning of the pandemic, we were reusing things like face masks and gowns and things that when we were in nursing school, we never did that. And we were doing that because we had to get by. And so focusing on resilience is so important. And so this was very timely. The other part of that was that our staff were particularly challenged working with COVID positive patients in the psychiatric setting, because they're not laying in beds being sick. The people we were seeing had higher psychiatric acuity on our COVID unit than they do COVID illness acuity. So these folks are up and walking around, and many of them dealing with psychosis. And so the staff members actually have to wear their full PPE for their entire shift. And this is different than we were seeing in the acute care settings, where you go into the patient's room, you put on your PPE right before you go in there. So they're working in hot space with patients who might be showing very challenging behaviors. And so it was a tough time. And then the other thing we're seeing is our volume of patients that we've been caring for. We are breaking 110-year records with the number of patients that we're serving in our facility right now. And so our teams were feeling very exhausted. And we were short-staffed at times. There was a time during the pandemic that we had 90 people out, either who had COVID or who were being tested for COVID. And so we struggled with the staff shortages too. So it was just the need to kind of flip our script from feeling sorry for ourselves to like, we are going to prevail and resilience is important. When we can go to the next slide, Randy. When Randy approached me about this grant, so first of all, I have to say that I have a very special place in my heart for chaplains. So my dad's a minister, but also he was a police and fire chaplain in Wisconsin. And so I have a very special connection to the chaplains here at Pine Rest, and just value the work that they do so much. I've worked at Pine Rest for 21 years. I've just seen the beautiful interactions between the healing moments between our chaplains and our patients, and then also how our chaplains care for our staff and how much our staff incorporate them into our treatment teams, how they go to them for prayer requests, for spiritual support and comfort. And so to me, this was just an easy win for our staff. So how do we engage them? We had to get really creative, because we were talking that we were we started this in a time where you weren't even really supposed to have more than 10 staff members in a room together at any time. So how do you start a program like this where you're wanting to do some group activities and education? So we started having huddles. We invited the chaplains to come to staff meetings. And then we just asked the managers to get creative. So I know we used some telehealth options at different times. And so engaging staff in this wasn't too difficult. We just had to get creative about it. And our leaders also see the value of the chaplains that we have. And then finally, if you want to go to the last slide, just the impact of this. So we've heard a lot of staff appreciation and gratitude for this. And Bob referenced, sometimes it's tough to get people to reach out for the help they need. And our EAP program is such a strong program. And we have found, Bob and I have worked together where I'll send him an email or call him, hey, can you check in on these people for me? Because I know that if I just give them an EAP card, or if I say, please call Bob, it's not necessarily going to happen. Those of us in behavioral health like to be tough guys. And we think that means not getting the help that we need. And so for some of our staff, talking to a chaplain was a little bit of an easier sell than talking to EAP, which they think, oh, therapist, I'm tough, I don't need to do that. So staff have been very gracious about that. They feel free in speaking with the chaplain. And then I was just going to share my own experience with this. The labyrinths that have been out for staff to use have been very impactful. So I had a time during the pandemic. During the pandemic, my dad was diagnosed with terminal cancer, and we were shocked because he had been very healthy. And so I was going through this challenging personal time, and then we also had challenging things going on at work. It was around the time we were opening our COVID unit. It was very stressful. And I was walking down the hallway, and I remembered, hey, this is the room where the labyrinth is. I peeked in, no one was in there. I think I used it outside of the posted hours, but I took that time to prayer and center and meditate as I walked through the labyrinth. And there was some reflective, there's some handouts with reflections to do. And so for me, that was a meaningful time. It helped me kind of center myself, remember the purpose of why we were doing this really challenging work, being able to kind of set aside my worries over, my dad's illness and be able to focus on the work at hand. And I've used the labyrinth within the acceptable hours since that time. And I think there's just hours posted because sometimes we allow our partial patients to use that. So I am so grateful that we had the opportunity to support our staff, to flip the script and talk about resilience, and then to just give them the opportunity to have more tools to help them prevail through this very difficult pandemic. So thank you.
Yes, thank you, Gretchen. And, I think the theory and the hope is right. More resilient staff can offer more resilient care to our patients who are also experiencing this. But some of the unintended benefits to patients are actually directly. One of the creative things we had to do was convert a space it was our larger space, and we had to convert it into a space where the partial day program patients would also use it during specific hours. And we had our labyrinth set up on the other side of that space. So we were able to offer this to patients, and chaplains were able to actually offer groups where they could use the labyrinth with patients. So we had to get creative in our interaction of this space is for staff and this space is for patients. So it's an unintended benefit to the patients directly that we hadn't planned on before we had to get creative. So I think we are to the point of questions. So Michael, would you want to, I'm going to stop sharing our slides. I'm going to leave our contact information here. If you have any questions for me or Bob or Gretchen, you'll find our emails there. We're willing to connect with you if that would be helpful. And I'm going to stop sharing and let Michael facilitate our questions. We'd love to learn with you here.
Great, thank you very much. And I should say, thank you for sharing your contact information, Randy. And anyone, if you do have questions, you can also send them to me, and I can
Yeah.
sort of farm them out as necessary and appropriate. Thank you. This is so interesting to learn the Pine Rest sort of model and where this fits into everything. This is clearly an organization that is dedicated to the well-being of its staff. So kudos to all of you for the work that you're doing. This is really wonderful. I'm going to kick us off with just a couple of questions that occurred to me while you were talking, but we've got plenty coming in through the chat in the Q&A as well. I wanted to ask one sort of follow-up questions on the specific needs as they pertain to resilience for staff working at a mental health facility. And I think that if we can understand a little bit better what resilience looks like for your staff, that'll kind of bring it out into contrast so that some of the chaplains that are with us today will understand what to be looking for in their own institutions, even if it's not mental health. So what kinds of issues were staff presenting in your all's setting, and what did resilience mean for them beyond, oh, I'm tough, I can push through this, and that kind of mentality, which we know a lot of folks try to push through with?
I'll start with something, and then Bob or Gretchen, if you want to jump in. But because we have the name Christian in our title, we do get critiqued from kind of two angles. One is we're not Christian enough, and from the other angle is we're too Christian. And same thing for staff. So we have Muslim psychiatrists, and I know we have Sikh staff, and Wiccan, pagan, Christian, non-affiliated, agnostic. I mean, you run the gamut. I think they work here. And so just the stressors in terms of fostering spiritual resilience, the challenge in a Christian organization to legitimately respect and accept, so respect the diversity and also accept that diversity. There's a unique challenge there when a chaplain approaches a staff and they have a particular preconceived idea of who a minister is going to be. We have, all the clinical training, that comes from CPE. So that's not how we approach them. So I think that was one particular, and so I think the heightened anxiety of COVID heightened some of that other anxiety when we see staff that are crying or have to step off the unit to take a break, or are short-tempered, or kind of watching their own boundaries with a substance use patient or a particularly difficult diagnosis. So there were a lot of those things to be aware of in terms of just dynamics of our pastoral approach.
Mm-hmm.
And so as we've become more visible through this grant, more staff are now seeing us. So they're getting used to me being, oh, you're the guy sending the resiliency modules. Oh, and so we're seeing more people, and we're having to budget more time just walking to a unit, because we could walk to a unit before. Now we get stopped 3 or 4 times as staff want to talk to us. So these are the kinds of things we're noticing and how we're adapting.
Wonderful. Julian asks a great question. I was wondering it myself. That's not why I think it's a great question. It is on its own. But Bob, you mentioned changing language to foster resilience, and Julian asked for some examples for that. And I think that this idea of language is so interesting. How do you present yourself as a chaplain? What does that word mean? So Bob, what did you mean by that? And how is resilience presented for those who maybe don't understand this is something that can be shored up to help?
Yeah. We're not born resilient. It's resilient as a set of skills and decisions that we make. I like the definition: resilience is the ability to prepare for, adapt to, and grow from hardship. And part of that is just having in place an expectation of recovery. The medical professional will tell you that patients who expect to get better are more likely to get better than those who don't. And if leaders come across with language that victimizes, you poor dear, you'll never be the same, those leaders have a lot of destructive power there. And if instead there's a sense of we will, we shall, we can, that sets in place. So using plural pronouns and future tense verbs is really important. Normalizing the reactions to high stress or potentially traumatic event really helpful, because otherwise, if I can't sleep and I worry about it and sleep less, and worry about it and sleep less. And so being able to normalize and to move forward, not minimizing the impact of the event, fully acknowledging it, but moving forward as well. That kind of language really makes a big difference.
I could add to that. I think even just the name fostering resilience, we didn't want to come across as presuming to give staff resilience. I mean, they're resilient. The fact that they showed up again on another shift, they have some resilience.
Yeah.
So we're fostering their own resilience, and yet there was a small educational piece, because sometimes we have coping skills and coping mechanisms which aren't the healthiest. And so we can also kind of educate and speak to some of the different factors of resiliency. It's not just, suck it up, buttercup. It's like, how, Bob said, how do we ask for help? That's resilient.
Yeah.
Todd Smith asked this great question. Can you please just repeat the definition of resiliency that you used? I think this is going to be really helpful to some people.
Okay. Resilience, again, it's a set of decisions and practices that help people prepare for, adapt to, and grow from or during hardship. Yeah.
Someone asked, Chris Dumas asked about the self-assessment survey. Where was that? Where did that come from? Was that something that you generated in-house, Randy? What's the genesis of that?
Yeah, thank you. That's a good question. And we looked long and hard for resilient surveys that were out there. Ultimately, what we used was the work of Steven Spidell, and he has 20 factors of resiliency. And we took each of those 20 factors and we wrote a question, on like a 7-point scale. Do you see yourself as easily adapting to change? Do you see yourself as a spiritual person? I mean, so we looked at those 20 factors and wrote a simple question. And out of that, we selected 12 of them that we were going to create educational modules on. And then we use all 20, so we'll do a 20-week reflection. So each chaplain is going to write a short Hazelden style reflection on each of the factors. So each factor will get touched on, but 12 of them got highlighted.
Thank you, Randy. And if you could send me some of that material from Steven Spidell, I'm sure there are some folks who would like to see that directly themselves. This is a really great question. It's a little bit long, but I think reading it in full will be worth our time. I work primarily with staff who like to be tough as I cover the ER and a COVID unit transitioning back to medical surgical. Grief wreaths and such are things that they kind of laugh at, and generally they just want pizza for me to say hi. But the volume they deal with is crazy, over 130 a day in the ER of a level 1 trauma center, combative patients, security, etc. Many staff are former military RNs or techs, and many seek to move on to that. Are there any suggestions into how to cut through their hero armor? That's a great question, Diana.
Bob, I think you're on mute. You want this one? Yeah.
Thought I got it. I'm going to spend a lot of this week with law enforcement. So I understand the blue line and that sense. The key is, there are ways to break through. And one is, don't challenge it all immediately. Don't put it in their face, because oftentimes that tough exterior is there on purpose, and that's their armor because they're not that tough inside. But they do need to stay sealed over while they're on mission. And so timing is very important. So maybe you have the debriefing while they're eating pizza, and maybe you come alongside them and do what's familiar to them. There's language that you can use. You can use, maybe you're right. Maybe this isn't needed for you, but in my experience and in lots of studies done by military, law enforcement, fire, those are tough guys and gals. They find that your presence here could be really helpful to somebody else. And just something you say, a head nod, make an eye contact, you'll never hear it from them, but you could really be helping one of your colleagues by your presence here. So yeah, if I run into groups that are really resistant like that, I mention the military, firefighters, and cops a lot in emergency. You can also, if you want to, in a time when they're not being defensive, show them stats, because the stats about the impact upon folks in those high impact professions are pretty brutal. And so, no, don't do it for yourself, but do it for your buddy and do it for your kids.
And as a nurse, I would echo what Bob said, that meeting them where they are is important. Reference their colleagues, like that you also want to support their colleagues, that they could role model that. And then I think bring them the pizza and just hang out, so that when it gets to the point where they really do need that level of support, that they've already made that connection with you. So if they do get to the point where they're willing to reach out, which is not going to be on shift, because they have to keep the armor up to be able to get through the shift. So if they reach out to you, it might be after the shift is over. It might be when they walk away right after something happened that's very emotional out in the hallway. But having that connection that you've made and built that trust will make it easier for them to reach out.
Randy, I'd like to ask you to revisit just for a moment. You discussed at the beginning the process of this grant, hearing about it, deciding to pursue it, that sort of thing. This question says, did you have any resistance from leadership, as in we don't want to talk about or focus on the negative? I think that's a really great question, because I know some chaplains are encountering this. If you could say a little bit more about Pine Rest's approach to staff and why this was something that really fit in with what was already happening. I mean, I think the answer is no, there was no resistance from leadership. But if you could say a little bit more about why that's the case, I think that'd be really helpful.
Oh, wow. Yeah, I love it. Amy can correct me if I'm wrong, but I also don't think there was resistance from leadership in terms of supporting the staff. I think, it has both been historical and current sort of missional practice that our chaplains are here for staff and patients, or patients and staff. So we know that's theoretically and in practice what we're trying to do. This grant really allowed us to expand on the and staff. So going from, I'm on a unit and I'm in the nursing central location there, and you're like, hey, how's it going? Wow, it's rough. Oh, you try to do a quick empathic statement, or let's talk on break, and then you miss them and they're gone, to now we actually have time to do this. So this grant really extended sort of this core chaplain mission of, care of the patients and staff. Now we're like, yeah, wow, we have the resources to care for staff now. Not that we didn't before, but this really bolstered that. So I don't think we had any resistance in terms of that. I will highlight we had a little resistance to the survey, because the survey comes really close to research. And so speaking of pizza, we did offer a bonus. We had some prizes that we offered, and that I think helped get our response rate so high, because people are like, hey, I don't have enough PPE, but if I had some pizza, I can do anything, and that helped with the survey as well. So I think that was crucial.
And I think that for this situation, we didn't have that resistance, but that's also been decades of work to get to this point too. There has been times, and maybe not organizationally, but on specific units, where there has been resistance to some of this, the resiliency model, or even chaplaincy intervention. And that's really taken finding organizational champions to help kind of open some of those doors, and invite someone like Bob to a staff meeting and eat pizza with staff and just talk to them. And so it's taken some work to get to this point. It's not, I wouldn't say that it's always been just really easygoing. Would you agree with that, Bob, Randy, Gretchen?
I would, and I'd say the last decade in particular with our current director, he's, built the trust, rebuilt the trust, and so we do have staff and leadership do trust the chaplains to care well. We're not proselytizing, and we're not forcing a religious view on people. We are really working within our clinical expertise. So, Bob.
Yeah, I think part of it, Pine Rest is a very mission-driven organization that genuinely cares about its staff and its patients. But it was easy to present the business case as well. When we started the resilience program before we got the chaplain, but when we started the resilience program, there was a residential program that just had some horrible numbers. It was kids who averaged 12 failed placements before they came to us, and our staff were getting assaulted. And we had a lot of new staff who wanted to be a psychologist someday and got assaulted or witnessed something awful and quit. And so by providing some of this additional support, they had a wonderful turnaround in terms of retaining staff. They had less assaults because people stuck around good enough to get good at their jobs and to talk people down. They had fewer restraints and those kind of things. And those are all measurable outcomes. So, and the chaplains had a wonderful reputation in the organization. And so putting the two together, if you had any resistance, I'd be surprised.
And I do want to mention, this is something that I could say because these folks haven't said it. This is outstanding. This is an incredible accomplishment that requires a lot of organizational sort of coming together. And for folks that are with us today, if you're thinking about going after some sort of grant funding opportunity, this is a wonderful model of how to do it. When we announced this grant program, one of the real conditions of every proposal was you have to have institutional support and buy-in. We need to see that at the very beginning, because there are lots of ideas that anyone can implement, even without grant funding, but without the institutional champion, it just doesn't get off the ground because it requires so much time, effort, other resources. So that's such a crucial part of the success of this work. And so I really do commend you all for this, because it's such a wonderful example of what good can happen when an organization recognizes the value of chaplains and supports them in their work of staff. Now, I do have to swing on the other end of the spectrum to ask a question, and I think this is going to be really helpful because some folks are not in organizations that are as well resourced as the chaplains at Pine Rest. So the question is, what practice do you recommend for an institution that has no history of spiritual integration, a limited staff? He mentions one chaplain for 350 beds, and was dramatically impacted by COVID. My physicians and staff are reluctant to even talk about their experiences or seek help. So if I have 10 minutes to give them an invitation to resilience, what should I emphasize? So for folks that don't have what you all have, how can you foster resilience?
Bob can maybe speak to if you only had 10 minutes, how would you present it? I think what I would suggest is before you ever get to that meeting. So as a chaplain, you are demonstrating your care for leadership. So it's not always approaching leadership with your request for your department or for yourself, but you're approaching everyone within the organization with the same level of, I'm here for you. And so that's how you start to build the trust. And when you care for the leaders and the stress that they're under, and sort of trusting and accepting them as they're caring for people within the organization, you're demonstrating that you're someone that they can also trust their staff with. But if you only come to them with agenda items and wish lists, then, yeah, that's maybe what they're there for, but no, they're people too. And so I think approaching each person within the organization, and so you have to do that legwork, and that might be a part of the initial part of the resiliency, is how do I get time to start a relationship with my administrator, with my manager, with my director, because I'm a chaplain in the organization, and they may have a different view of that, but then there's some education. I'm here for you too. I'm here for your staff too. So I think that's where I would start if you are like legitimately the only one, I would start with those relationships, and then Bob can help with the presentation.
I would go straight to Gretchen. And Gretchen, you're leading people here. And if I'm coming in from the outside, whether it's as a chaplain or as an EAP professional, the first thing we want to do is we want to position leadership, and we want to consult, and we want to learn from you about what are the unique needs of your team and the strengths of your team. And we want to do everything we can to pour into you, because we're going to be there for a little bit and you have to come back again tomorrow. And that's the place to start, is start fostering the resilience of those that are in leadership. The military has that model of how do we invest in our second tier officers, because then it's going to trickle down. And Gretchen, you're the expert on your team, so I think it has to start with you.
Yes, I agree. And I think those, but the other part is role modeling, right? And Bob kind of talked a little bit about that when he presented. So part of that was like, I was wearing PPE and going out on the units, and I show up twice a week in scrubs, and I'm out on the units when I'm on my scrub days, so that people see, like, really at my core, I'm a nurse too. I'm not going to ask you to do anything that I wouldn't do myself. And if I need to take care of myself, I am going to role model that as well, that it's safe to ask for help. And the other thing that I think I wanted to mention, and I neglected to, is that our chaplains were out there, and we sent a big chunk of our staff home when the pandemic started, and they worked from home, and that was important. And the work they could do from home, and they were doing their part to stop the spread. And then there was a chunk of us that couldn't go home, that our work was here in the hospital, and that we needed to be there to do the work. And our chaplains were alongside our staff, wearing the PPE in the trenches with them. They showed up. And I think it was a phrase that we kind of started in our administrative hallway during the pandemic, is we show up for each other. And our chaplains showed up for our staff. They were on the special care unit with the COVID positive patients, wearing their PPE right alongside them. And I think that just says a lot. We're walking the walk. So that, I think that was extremely helpful during that time.
Thank you very much. There's one more question. It's a very quick one, so we can handle it very quickly. Will you be publishing the results of all this? And what I'll say is that this was not a research project with a capital R. So we're not talking about, IRB covered research. We do want to make sure that of all the projects, there were 16 projects within this overall program, that they are as portable and useful to as many people as possible, right? We're not just doing this for Pine Rest. We want Pine Rest success to be a model for others as well. So as this grant program unfolds, anything that can be sort of taken from it and used elsewhere, we're going to make sure that you have access to that as well. This webinar is a great example. It's going to live forever on the website, and so you can always go back and find whatever is helpful from it. We're here at the top of the hour, so I'm going to thank all of our guests for your time and for being with us today. This has been so wonderfully informative, and I'm so grateful to see Randy, hospital leadership. This is the way that we want chaplains to be able to work in healthcare settings and mental health settings, and it's such a wonderful example of success. So thank you all for being here. Thank you to our audience for joining us today. If you missed anything, like I just said, don't worry, it's recorded. You can always go back and watch it later. And then finally, I want to thank the Henry Luce Foundation for their support of this project. Thank you all again. Have a wonderful afternoon. Bye, everyone.